For decades, we've been told the big three, the three pillars of heart health. Watch your diet, get more exercise, and know your cholesterol numbers. We've focused on our plates, our running shoes, and our blood pressure cuffs. We've done everything right. But what if one of the most significant threats to your heart isn't on your plate, but is hiding in plain sight, right inside your own mouth? Heart disease is the #1 killer of men and women in the United States. That is a grim, established fact. Here's another fact, one that's far less discussed. Periodontitis, or severe gum disease, affects over 60% of adults over the age of 65. For the longest time, we viewed these as two separate problems, one for your cardiologist, one for your dentist. We've treated the body as a collection of disconnected parts. Today, we are going to challenge that assumption. We are going to expose why this is not a coincidence. How can bacteria from your gums possibly clog an artery in your heart? It sounds improbable, almost like science fiction, but the scientific evidence is now undeniable. And it's a connection that your family doctor may not have ever discussed with you. In this video, we are going to do a deep dive. We will follow the science. We will trace the journey of a single bacterium from a bleeding gum all the way to the site of a potential heart attack. We will uncover the hidden fire of inflammation that connects these two diseases. And most importantly, I will give you a clear, science-backed action plan to protect not just your smile, but your life. Host. First, we need to be crystal clear about our villain. We are not just talking about gingivitis. You've heard that term. Gingivitis is the early stage. It's mild inflammation. Your gums might be a little red, a little puffy, maybe they bleed when you brush. At this stage, it's completely reversible with good hygiene. We are talking about its far more destructive older brother, periodontitis. In a healthy mouth, your tooth sits in its socket, and the gum tissue forms a shallow, tight-fitting collar around it. A dentist measures this space, called a sulcus or pocket, and in a healthy mouth, it's only about 1 to 3 millimeters deep. But when plaque and tartar build up, that bacteria begins to grow downward. The body sees this as an invasion and launches an immune response. The problem is, the bacteria hide in these growing pockets, and the immune system, in its attempt to destroy the bacteria, starts destroying everything, including the very bone and tissue that hold your teeth in place. This creates a deep, dark, oxygen-poured trench around your tooth. This trench can become 5, 7, even 10 millimeters deep. And this trench is the perfect home for the most dangerous anaerobic bacteria, bacteria that thrive without oxygen. We're talking about specific, nasty characters, with names like Porphyromonas gingivalis, or P. gingivalis for short. They form a complex, sticky colony called a biofilm, and they release toxins. Your body, meanwhile, is in a state of constant, chronic war. The tissue inside this pocket becomes ulcerated, raw, and bleeds easily. And this is the single most important concept to understand. A mouth with moderate to severe periodontitis is not a mouth problem, it is a chronic wound problem. You are walking around with a chronic, open, infected wound in your mouth that can be the total surface area of the palm of your hand.
Now, what happens when you have an open wound and you apply pressure to it? What happens every single time you chew. This brings us to Act 3, the mechanism. How does the villain get from the mouth to the heart? It happens in two distinct ways. The first is a direct invasion. The second is an indirect, systemic attack. Let's start with the direct invasion. You have this raw, bleeding, open wound in your gums packed with bacteria. Every time you chew, every time you brush, every time you floss, you are pushing these bacteria directly into your bloodstream. This isn't a theory. It's a medical fact called transient bacteremia. Transient meaning temporary, and bacteremia meaning bacteria in the blood. For most healthy people, the immune system clears this out quickly. But when you have periodontitis, you are doing this every single day, multiple times a day. You are constantly reseeding your bloodstream with highly inflammatory bacteria. And here is the smoking gun. Scientists and pathologists have analyzed the plaque, the atherosclerotic plaque that they've removed from the clogged arteries of heart disease patients. And they found P. gingivalis, the exact same bacteria from those deep gum pockets, living inside the arterial plaque itself. These bacteria are deviously clever. They have adhesions, which are like sticky hands that allow them to grab onto and colonize the lining of your blood vessels, particularly in areas that are already slightly damaged. Once there, they can directly promote inflammation and plaque formation. But as terrifying as that is, this direct invasion isn't even the main story. The main story, the one that affects everyone with gum disease, is the indirect attack, inflammation. Think of that chronic war in your gums we talked about. It's a low-grade, simmering battle that never, ever ends. Your immune system is constantly sending troops, constantly releasing chemical alarm bells. These alarm bells are called inflammatory messengers, or cytokines. These messengers don't stay in the gums. They're dumped into your bloodstream and circulate throughout your entire body 24/7. This puts your whole body on a state of high alert. It's a condition called chronic systemic inflammation. Your doctor can actually measure this. There is a simple blood test for something called C-reactive protein, or CRP. CRP is produced by your liver in response to inflammation anywhere in the body. It's a general smoke detector. And what we see, time and time again, is that people with periodontitis have significantly higher levels of CRP in their blood. So what does this inflammation do? If you already have some plaque buildup in your heart's arteries, which many of us do, this systemic inflammation is like pouring gasoline on a smoldering fire. It makes that plaque angrier. It makes it unstable. A heart attack is rarely caused by plaque slowly closing an artery. It's caused by a piece of that plaque suddenly rupturing, forming a clot, and blocking the artery instantly. And this systemic inflammation, which started in your gums, is one of the primary drivers of that instability. It makes the plaque friable, meaning more likely to break off and cause a catastrophic event. Think of it this way. The gum disease is a fire raging in the basement of your house. Even if the fire stays in the basement, the smoke, the inflammation, fills the entire house, causing damage on every single floor.
Now, I know this sounds alarming, so let's look at the hard evidence. This isn't just a theory, it's a field of study backed by decades of research. Evidence point 1, the association. The American Heart Association has officially recognized the link between gum disease and heart disease. Large-scale epidemiological studies, which follow thousands of people for many years, have consistently shown that individuals with periodontitis have a 2 to 3-fold increased risk of having a heart attack, stroke, or other serious cardiovascular event. This association holds true even when researchers control for other common risk factors like smoking, age, and diabetes. The gum disease itself is an independent risk factor. Evidence point 2, the CRP marker. As we discussed, we can measure inflammation with the C-reactive protein blood test. High levels of CRP are a well-known independent predictor of heart attacks. And study after study shows a direct dose-dependent relationship. The worse your periodontitis, the higher your systemic CRP levels. Evidence point 3, the treatment. This, to me, is the most compelling piece of the puzzle. What happens when we treat the gum disease? Clinical trials have taken patients with severe periodontitis and given them a deep cleaning, a non-surgical treatment called scaling and root planing, which removes that bacteria-laden tartar from below the gum line. The results are astonishing. Within weeks to months, these patients' blood markers for inflammation, including CRP, significantly decrease. Other studies have shown that treating gum disease improves the function of the endothelium, the sensitive inner lining of our blood vessels. It makes them more flexible and less sticky. Some research has even shown that it can slow down the thickening of the carotid artery wall. The conclusion is inescapable. You heal the gums, you help the heart. So how do you know if you have this silent, hidden fire raging in your own body? Your gums will try to send you warning signs. The problem is, we've been conditioned to ignore them. Please, do not ignore these 5 red flags. Bleeding gums. This is the #1 sign. We've been normalized to see a little pink in the sink when we brush. This is not normal. Healthy gums do not bleed, ever. Bleeding is a sign of an active infection. Red, swollen, or tender gums. Healthy gums are firm, pale pink, and resilient. If your gums are dark red, purple, puffy, or tender to the touch, they are inflamed. Red flag #3, persistent bad breath. We're not talking about morning breath or what happens after a garlic-heavy meal. We're talking about a deep, persistent, unpleasant odor that doesn't go away, even after brushing. This is often caused by the toxins released by that anaerobic bacteria deep in the pockets. Receding gums or long teeth. Do your teeth look longer than they used to? This is a sign of advanced disease. It means the gum and, more importantly, the underlying bone is being destroyed and is pulling away from the tooth. This is severe periodontitis, and you need to see a dentist immediately. If you recognized any of those signs, do not panic. Be empowered. You now have the information. So, here is your 3-step action plan to protect both your gums and your heart. Get a professional, honest assessment. This is non-negotiable. You must see a dentist. And when you do, they need to do a periodontal charting. This is where they use a tiny, painless measuring tool to check the depth of those pockets around each tooth.
The tone is the only way to know if you have healthy 3-millimeter pockets, reversible gingivitis, or the 5-millimeter, 7-millimeter, or deeper pockets of periodontitis. If you do have periodontitis, the treatment is straightforward. It's that deep cleaning we mentioned, scaling and root planing. This is the essential first step to getting the infection under control. Master the daily disruption. Your mission at home is simple. You must disrupt that sticky bacterial colony, that biofilm, every 24 hours, because that's how long it takes
to reorganize. This means two things. First, brushing twice a day for 2 full minutes. Use a soft bristled brush and angle it at 45 degrees into the gum line, where the tooth and gum meet. Second, flossing. And I mean flossing. This is the one thing most people skip, and it's the only tool that can clean the two sides of the tooth between the teeth. If you hate traditional floss, a water flosser or interdental brushes are good, but nothing beats the mechanical scraping of floss to break up that biofilm. Master the daily disruption. Build the bridge. Talk to your doctor. This is the step that connects everything. The next time you see your primary care physician, tell them what your dentist found. Say the words. My dentist diagnosed me with moderate periodontitis. Your doctor needs to know this. Knowing you have a significant chronic inflammatory load may change how they manage your other cardiovascular risks. They may want to be more aggressive in controlling your blood pressure, or be more vigilant about your cholesterol, because your total inflammatory burden is higher than they thought. Decades of siloed medicine. For decades, we have viewed the mouth as separate from the body, a problem for one specialist, not the other. That era of siloed medicine is over. The science is clear. A chronic, smoldering infection in your gums is a chronic, systemic threat for your heart. Why didn't your doctor tell you this? It's likely because our medical and dental systems are still tragically separate. They have different insurance, different buildings, different training. But you are not a silo. You are one single integrated system. Your dentist is no longer just a tooth doctor. They are a critical, frontline member of your cardiovascular care team. The most important phone call you can make after watching this video is to schedule that dental assessment. It's not just about saving your teeth anymore. It might just save your life.